Welcome to your guide to blood and marrow transplant at Mayo Clinic. As you go through the transplant process, you can turn to this program for a good introduction to each stage. It's designed to give you, your family, and other caregivers the big picture. It will answer some common questions and make it easier to learn the details later. There are many resources at Mayo Clinic to help you learn more about your condition and treatment. Your healthcare providers will help prepare you and your caregivers for each stage of your transplant. Mayo Clinic is one of the world's leading medical centers for blood and marrow transplants. We provide hundreds of transplants every year to adults and children. We're also involved in research on how to make these transplants safer, more effective, and more comfortable and available to more people. At Mayo Clinic, we believe strongly in the value of a healthcare team, professionals working together to achieve the best result possible for every patient. You are a member of your team. Your participation is very important at every step of the process. We hope this program is helpful as you learn about the potential benefits and the challenges of blood and marrow transplant. Thank you for watching.
People who have had transplants and their caregivers speak about their experiences in this program. The patient seen demonstrating the transplant process is an actor. The following information is an educational aid only. It is not intended as medical advice for individual conditions or treatments. Your experience may differ from the experiences depicted in this program. Talk to your healthcare provider before following any medical regimen to see if it is safe and effective for you.
It's just ridiculous how fast everything moved once I got diagnosed and my doctor got in touch with the Mayo Clinic, and then all of a sudden there I was, and I was up in a room and they were injecting stem cells in me, and then all of a sudden I'm back out, and it's just kind of like, whoa, what just happened? And I don't think it's really sunk in what I've gone through yet.
Welcome. In this chapter, we'll explain the basics of blood and marrow transplant. What it is, why it's done, and how it happens. The marrow is soft, spongy tissue inside some of your bones. Marrow has the very important job of producing blood cells. The cells are made by blood stem cells in the bone marrow. These stem cells are different from fetal stem cells often mentioned in the news. Different types of blood cells are created in the marrow with different jobs to do. Some of them deliver oxygen throughout your body. Others help your blood clot when you're bleeding, and others help you fight infection. Sometimes there's a serious problem in the marrow. It might begin producing diseased blood cells or fewer cells than the body needs. The bone marrow itself may become filled with abnormal cells. A number of diseases and conditions can affect the marrow. Sometimes the treatment for a disease, such as high doses of chemotherapy or radiation therapy, destroys the blood stem cells. In these cases, a transplant of healthy blood stem cells may help. This transplant used to be called a bone marrow transplant. That's because the blood stem cells usually came from the bone marrow of a healthy person. Today, you'll see the term blood and marrow transplant. That's because it's now very common to remove the stem cells from blood. From now on in this program, we'll call the procedure a BMT, or just a transplant. The most common type of BMT is called autologous. Auto means self. In this type of transplant, the stem cells are taken from your own blood or bone marrow. The other type of BMT is called allogeneic. Allo means other. In this type of transplant, another person provides the stem cells. Sometimes the cells are taken from a baby's umbilical cord after the baby is born. Here's a brief look at how blood stem cells are transplanted. First, healthy blood stem cells are collected for transplanting, either from blood or marrow. The cells in your bone marrow are deliberately destroyed. It's something like clearing a field before planting. Healthy cells are put into your bloodstream, which carries them into the marrow. You might think of this part as planting seeds. Ideally, the new cells thrive and begin producing healthy blood cells. The disease that caused the problem may or may not be permanently cured.
Actually, I'm doing really well. I had my 4th anniversary of transplant in March, so a couple months ago, and everything is in remission. I have energy, I can do everything I did and probably more than before I had the transplant, so I feel great.
Let's take a look at the major stages of the transplant process. The first stage is called screening. Candidates for a BMT are carefully screened to evaluate their health and strength. You need to be able to cope with the physical and emotional stress of the transplant process. In this stage, many tests are performed to see how well your heart, lungs, liver, kidneys, and other organs are working. A psychologist helps evaluate your commitment to the process and your ability to cope with the stress. If you and your healthcare team decide a BMT is the right treatment for you, the next stage begins, collecting the blood stem cells to be used for the transplant, either from you or a donor. Next, your bone marrow needs to be put into the proper condition to receive the new cells. This stage is called conditioning. It involves destroying the cancerous or otherwise abnormal cells in the marrow and throughout the body. It also prepares the body to receive the new stem cells. This is done with high doses of chemotherapy or radiation. Now comes the stem cell infusion stage. The healthy stem cells that were collected earlier are put into your bloodstream. That's called a stem cell infusion. Your health team may also refer to this as day 0. For the next several weeks, the transplanted cells travel into the bone marrow and plant themselves. Gradually, if all goes well, they begin creating new blood cells and replacing the bone marrow. This stage is called engraftment. During this stage, people stay near their healthcare team. They take medications to protect against infections and reduce side effects. They take care to protect their health. They work on building up their strength. The healthcare team does regular testing to watch for complications. Typically, the patient is not in the hospital during the engraftment stage, but stays near the healthcare team. The final step of the transplant is the continuing recovery at home. A BMT is more likely to be successful if it's done early in the disease process. Sometimes a BMT cures the disease that caused the problem. Sometimes it makes the symptoms go away and reduces the risk of the disease returning. In some cases, a BMT cannot stop the progress of a disease, but it may provide extra time and a higher quality of life to a person with a fatal illness. And sometimes the transplant fails. A BMT carries many serious risks. They tend to increase with age. That's why the screening process is so important. In some cases, the risks of a BMT are considered too great. Be sure to talk with your healthcare provider about the benefits and risks in your situation.
I think it was rather easy because the treatment that he was on, he was having so many side effects from, and there was no way to live even a normal life. So when we found out that he could have the stem cell transplant, it was an easy decision after speaking to the doctor and hearing what a great success rate they were having, and knowing that he could probably have some time where he wouldn't have treatment.
We've just reviewed the major stages of the transplant process, but the process isn't the same for everyone. Everyone's situation is unique. Ask your healthcare team any questions you have about your condition and treatment. Throughout the transplant process, it's important for you and your caregivers to work closely with your healthcare team. Ask questions, tell them how you're feeling, and let them know what you need. Our goal is to reduce your risks and help you have the best experience and results possible.